Oh, it's me, Dr. Hoagland again, and today I'm going to be reviewing some basic information related to hearing disorders in adults. And so it's going to get you started on this section. I also want to point out that on this section of the course, you will no longer be going to Master Clinician Network for your videos. You will be finding these videos on Carmen. These were videos that were made locally. And then in this case, they are also captioned like the Master Clinician Network videos are in case you need that. You'll just treat them as you would any other of the YouTube videos. First of all, I want to make sure we remember what types of hearing loss there are. There are two primary types of hearing loss, conductive and sensorineural. There is a third category that naturally is a combination of both. It would be a mixed loss. But I'm going to just review conductive and sensorineural today because you can presume that a mixed is going to be that basic information combined from both of those. So today I'm going to go over some information that you may not encounter as much if you're going to be a speech pathologist, but it's important to understand this in general, and it's important to have this information going into those videos. So first of all, I have one slide here to talk about conductive hearing loss in adults. I only have one slide for this because conductive loss is not as common in adults. If it is, it's going to be very transitory. Any kind of a more long-term conductive hearing loss is going to be the otosclerosis, as I discuss here. So most of the time, conductive hearing loss is going to occur in children. It's going to be things like otitis media with effusion or without effusion. And so adults just don't have as much of an issue with that for anatomical reasons primarily. In adults, conductive hearing loss, temporary loss is mostly going to be things like excessive cerumen. And that's easily corrected by just removing the cerumen. A number of individuals can do that, and it's fairly straightforward, easy to do. The issue of more concern for conductive hearing loss for adults is otosclerosis. And this is bony tissue being replaced by fibrous or spongy bone growth, typically in the oval window. So basically, you've got a growth of kind of a bony sort of a tissue, and that reduces the movement of the ossicles. So in this case, a conductive hearing loss, remember, is hearing loss related to the outer and middle ears. So with otosclerosis, it's impacting the middle ear, but the inner ear, which would be a sensorineural loss, the inner ear is still intact. In otosclerosis, it's a progressive development. So this bony growth occurs over time, and typically it's in both ears. It's a genetic condition. This is going to be corrected by surgery. So this is something that speech pathologists and audiologists don't deal with directly. It would be a referral to an ENT, an otorhinolaryngologist. So, but this is really the primary cause for conductive hearing loss in adults, with the exception of things like cerumen, which are very easily corrected. The other type of hearing loss, sensorineural hearing loss, is what we find most commonly in adults. The majority of hearing loss is sensorineural then. The first one I'm going to talk about here is presbycusis, which is age-related. Presbycusis comes as a result of just overall usage of the ears, environmental noise exposure, those things you encounter every day in your life, that occasional loud noise that you experience in either briefly or a little bit more extended period of time. Drug effects, some medications can impact hearing. That accumulates over years. So even if you take a drug for a very short time, it can have a long-term effect on your hearing, even if you don't notice it for many, many years after. One of the significant issues with a sensorineural hearing loss in adults, presbycusis, etc., is the long amount of time it takes for an impact to be noticed. Genetic disposition, some people just genetically are more inclined to have their ears wear out and develop hearing loss just because of that individual variation we tend to have. One of the characteristics you see with presbycusis is that you can hear people talk but have a hard time understanding what they're saying. This is true of sensorineural loss across the board for the most part. But presbycusis, we see that the changes we see in the hearing ability affects a lot of the speech the speech range, and so we can hear people, but we can't particularly understand what they're saying. Another characteristic that goes with hearing loss with adults is tinnitus. It's not explicitly a hearing loss, but it corresponds. It's correlated. Excuse me. It's correlated with hearing loss. So we see this with a lot of noise exposure and hearing loss over time. This is the ringing in your ears that a lot of us experience. Most of us have experienced it at some point in our lives. It corresponds with a temporary threshold shift for a lot of us after you've been in a loud environment, a bar, a football game, any kind of a loud environment. Sometimes that threshold shift will return so to typical hearing, or it might stay elevated. I have a link here to a video related to tinnitus treatment. Tinnitus is notoriously difficult to treat. A lot of people live with it, and it is very problematic for a lot of people. But there's constantly new developments in tinnitus treatment, and this video will illustrate some of that. The next diagnosis I'm going to identify here is Meniere's disease. And this is kind of a reminder that the inner ear also it relates to balance. Remember, the inner ear is the cochlea, but it also has the semicircular canals that relate to balance. Meniere's disease, we don't really know what causes it for individuals, but it consists of tinnitus, pressure differences, and vertigo, that balance issue. So those are primary with Meniere's disease. It's related to a buildup of endolymph in the inner ear. So it affects some aspect of hearing as well as balance, with the hearing thresholds being very fluctuating. They'll vary over time. This is generally unilateral. And again, we don't really know what causes it. The treatment for it at this point is a small device it's addressing the tinnitus as much as anything. So Meniere's disease can impact sensorineural hearing. And again, a lot of it has to do with vertigo, the balance portion of the inner ear. The next cause of hearing loss, sensorineural hearing loss in adults, is ototoxicity. This happens when, this is the term describing damage, the toxicity, the damage to the inner ear from medication. So this results in sensorineural hearing loss. A lot of times these medications relate to life-threatening illnesses. A lot of the ototoxic drugs are chemotherapy. So we see an increasing occurrence of ototoxic hearing loss as a result of improvements in cancer treatment and chemotherapy effectiveness. So one of the effects of improved cancer medications is we are seeing an increase in sensorineural hearing loss in adults as a result of that. There are other medications that are ototoxic. Large doses of aspirin can be ototoxic. Some specific sorts of antibiotics can be ototoxic, but we primarily think of chemotherapy in this context. So that's a cause of sensorineural hearing loss in adults. The next one I want to talk about here is vestibular schwannoma. It's also referred to as acoustic neuroma. And this is something we'll encounter with adults with hearing loss, is they'll have this diagnosis of this tumor on the 8th nerve. The 8th cranial nerve is the one that is connecting the brain to the cochlea. Both the vestibular side with the semicircular canals and the auditory side in the cochlea itself. So this nerve is what's innervating, sending information to the ear and from the ear to the brain. So when there's an acoustic neuroma, we see symptoms of pain, hearing loss, tinnitus, and dizziness. So since it's affecting impacting both cochlea and semicircular canals, we'll see symptoms related to both aspects of the ear. For the treatment for an acoustic neuroma is surgery. So that the tumor will be removed surgically, and that typically results in complete hearing loss in that ear. I have a link here to a video for a person related to a person who had an acoustic neuroma and her treatment. So you can watch that video for her story as well. So for the rest of this, the slides, I'm going to talk about managing hearing loss, because a lot of the treatment we deal with for sensorineural hearing loss, because it's not reversible in the vast majority of cases, is how do we manage it. And so the primary focus on that is oral rehabilitation. And oral rehabilitation is an ecologically interactive process that facilitates one's ability to minimize or prevent the limitations and restrictions that auditory dysfunctions can impose on well-being and communication, including interpersonal, psychological, educational, and vocational functioning. And this definition comes from the American Speech Language Hearing Association, which is the largest organization, as we know, for speech pathologists and audiologists. So that's their definition. So basically that's telling us that oral rehabilitation is whatever is involved with working with the individual with the hearing loss and allowing them to minimize the impact of that hearing loss. And it's not just about hearing, it's about well-being, it's about all aspects of the person. So oral rehabilitation is not just about hearing, it's about the entire person. So oral rehabilitation has impacts, it involves a variety of angles. And I'm going to go through each of these briefly in the rest of this presentation. So hearing aids includes assisted listening devices and alerting devices, auditory training, speech reading, cochlear implants, and counseling and strategies. So we're going to go through each of those. The first one I'm going to talk about is hearing aids. And hearing aids are those electronic devices that amplify sound. They've become much more sophisticated over time as they've become digital, and we've got further options for how to modify sound for hearing. Hearing aid selection includes assessment, selection and fitting, verification, and orientation. Again, this is from ASHA. I will have a video for you to watch in a few slides that will give you some more information about this hearing aid selection procedure. But these are what we usually think of first when we're thinking about treatment for hearing. So hearing aids, as I said, they amplify sound. The first of those types I've got here is in the canal hearing aids. So these in the canal aids are very invisible. They fit down into the ear canal of the outer ear. You can see a little white spot on each of those that I'll highlight there, that are make it easy to be able to pull those out of the ear canal when they have to be dealt with in terms of service, cleaning, battery changing, things like that. So those are very small. They're no longer the smallest hearing aid available, but those are among the smaller ones. The next one is in the ear hearing aids, and these fit into the outer ear, more into the concha of the ear. They're a little bit more visible, but they also fit in the ear. So you can see that they're a little bit more substantial. Going back to in the canal aids, you can see they're red and blue. That's to help identify which ear they go in. In the ear aids, you can tell by the shape of them which ear they would go into. The in the canal aids do not have that kind of distinction, so they're color coded so people know where they go. The next one is behind the ear hearing aids, and these are more powerful. These are the ones that have been around longer. These also tend to be the most commonly prescribed because they meet a variety of needs. We see two kinds. One that requires that has like an earbud sort of insert on them that makes them easy to fit, and the other ones don't have that kind of end because those would have a custom molded ear mold that goes on those. The last one, I'm sorry, is obstructed by my image, but that's a bone anchored hearing aid, and that one has a surgically implanted aspect so that it's connected to the bone behind the ear, and that is designed to help hear in the opposite ear. It helps to provide a better ear assist for hearing in an impaired ear. So here on this particular slide, the way I've adjusted this now, you can now see the link to a hearing aid selection video talking about a variety of aspects used in selecting hearing aids. It's not just about the kind of hearing loss or the degree of hearing loss you have. There's a lot of other factors that go into it, including lifestyle, personal needs, etc. So I recommend you watch that video in addition so that you can see more information about how a hearing aid should be selected. The next item on the list is assisted listening devices and alerting devices. And this one includes things like FM systems. And unfortunately, again, the image I have here is behind my image. So if you look at the slides I have in addition, you can see what an example of one of these may look like. And this is any device, not including hearing aids, designed to improve your hearing, the hearing individual's ability to communicate. So FM systems utilize FM signals, like a radio sort of signal. To be sent from the environment. So if there's a speaker or a movie, an FM system allows this sounds to go directly to the person who needs amplification, provided they have the appropriate connection. It can have a hearing aid that it goes to. It can go to an FM receiver. There's a variety of ways it can reach them, but this way it uses an FM system to send sound directly to the person who needs to hear it. The next one is an alerting device, and this is a device that provides a visual signal and translates environmental sounds for the person to be able to process. So it allows them to have another form of signaling when they can't hear an environmental sound, say perhaps a doorbell or a telephone ringing. It gives them perhaps some other kind of a signal, a visual, a tactile sort of a signal, so they can alert to to the idea that there's a sound present. The last one that I've added here is a closed caption decoder. So a decoder that allows closed captions to be presented. Televisions, devices like that, have it built in, so you can just turn on closed captioning. So that decoder is built in. A separate decoder can be purchased or is available for other purposes where a closed captioning may not be integrated directly into the device. The next one I have here is auditory training and speech reading. That's another strategy for managing hearing loss. In this case, the techniques are related to teaching the person how to optimize the sound and cues so that they can assist spoken language. It might be environmental modification, where you sit in a restaurant, how you face somebody to get the best acoustic signal from them. It also includes some speech reading, and for that purpose I have included a speech reading video so that you can see the limits of speech reading. It's effective to a certain extent, but there's not a lot of information that can be gained this way, and to get this video will give you a better idea of how much is lost when you're just trying to do speech reading. A lot of common misconception is that you can understand perfectly well with speech reading, and that's just absolutely not true. So this video will help give that information. Next one is cochlear implants. So cochlear implants are an option available for some individuals. Cochlear implants provide persons with profound sensorineural hearing loss access to sound. So this is the person who's not going to get good benefit from hearing aids. There's nothing that we can otherwise do to give them acoustic signals. This is surgically implanted. Electrodes are surgically placed within the cochlea. So what it does then is that there's an external device that takes the acoustic signal, translates into electrical current. That electrical current then is sent into the implanted portion of the implant and then transferred into the cochlea, where it stimulates the nerve cells directly in the cochlea. So it's no longer an acoustic signal, it's an electric signal, an electronic signal that is sent to the brain. And as a result, it sounds different, and people who get cochlear implants have to learn how to process that sound, how to use that, because it's different than acoustic signals. And if they had hearing before and lost it and then get it back, they have to learn a different way of processing sound. The video I have linked here is just a description of how cochlear implants work. So give you some more information if you're not familiar with them at this point. The last one I have here is counseling and communication strategies. So that's the last of these ways that I want to highlight that audiologists and speech pathologists help individuals with hearing loss to deal with that difference in hearing. And in this case, the audiologist, or in some cases, the speech pathologist, played a critical role in educating clients with hearing loss. So counseling includes technological counseling, like helping to select which hearing aid, which assisted listening devices will be beneficial, what they can do with tech to make best use of their hearing. This also includes education about the limitations. A hearing aid is not going to replace the hearing they used to have. Understanding what those limits are is very important in this kind of counseling, so the person leaves with realistic expectations. It also includes advocacy training, how to speak up for yourself. If you have trouble hearing individuals around you, how can you speak up and get a better opportunity to understand what's being said? So advocacy for yourself is an important part of this kind of counseling. And also referral to support groups, because as with so many diagnoses that individuals may experience, support groups can be helpful for a lot of people, and this can be beneficial with sensorineural hearing losses as well, particularly with adults. So this is the last of the slides I have here. This is just, again, to give you some background, a little information about some of the diagnoses that go with sensorineural hearing loss or conductive hearing loss in adults, and the kinds of issues an adult will deal with. Again, as before with previous videos on Master Clinician Network, watch the video, keeping in mind the kinds of things that we've reviewed here and what the client's behavior or needs are, what the clinician is doing, and use that to apply for the quiz that will follow. In this section, because the videos are not Master Clinician Network videos, they are Carmen videos. The questions will vary based on the content of the video. They won't be the same format as the Master Clinician videos. So keep in mind when you get to the questions after, pay attention to what you've seen, and so that you can answer those questions effectively. And this, my background is a speech pathologist, but I have always had equal interest in hearing. And this is to reinforce that hearing is very important for both audiologists and speech pathologists to be aware of. And so, consider these as valuable as the ones you've watched up to this point in the course. So with that, enjoy these videos, and you'll see me again for the hearing difficulties in children.